Listen, I want to thank Zahid for bringing as many of us into the room as he has today. This is an incredibly broad, diverse group of people from, I've just looked at some of the lists of the people that are here, from senior all the way down to service users, people with lived experiences. This is a really exciting opportunity. Oh, wow. Is that better? We'll wait for thingy. I'll speak loudly in the meantime. I want to talk about the last taboo, which is children's data. We're probably pretty confident in this room that, you know, we all deal with children or adults with some level of mental or physical incapacity, and we're just totally comfortable with the idea that we would work with fairly intimate information that they give to us on a daily basis, and that we would use that for good. But the beautiful work that Jeff and co have started up here, I think is really important, but potentially doesn't go far enough. I want to propose that there's only one thing that really matters in any of this, which is, as Catherine has said already this morning, importantly, giving people control of their data so that it's central around them, especially if they're children, so that they understand what responsibility other people have with it. And I want to also suggest, I've now lost my train of thought, that's really embarrassing. And I want to also suggest that we've got a part to play in making that happen, which is a way of thinking about how we use data for good for those children and put them at the heart of their data. So I'm going to talk about a little bit about IT, but not very much, because I don't think digital is about tech. I think it's about, as we've rightly talked about this morning, people and their expectations of what the world should look like today, especially children. And I'm going to get in the way of my own microphone and poke this and talk for 2 minutes to convince you why this is important, and then 18 minutes about why it's going to be really, really tough. So this is the Barnardo's digital team. We're primarily female, apart from me, I'm the odd one out. And we are primarily based down in London at the moment, but if you want to come and commission us to open an office in Scotland, we'd be very excited. We have one goal, which is to redesign social care for children around their needs. Oh, awesome, thank you. Because we're all very conscious at the moment that commissioners get in the way, and sometimes we don't know what the right answer is, but children definitely do. So that's our mission statement. And now I've done that a bit. This is why it's important. So this is Abney Park. This is one of my favourite parks in London. It's a beautiful old cemetery, which is really old and overgrown, and is very good for hiding in. And on any given evening, you can walk into Abney Park and find bunches of people of all ages and backgrounds sitting on park benches, talking to each other and having good conversations and good time with each other. And often you walk around and you notice there are some sort of slightly kind of young, cool adults walking around in hoodies, talking to other slightly younger children about complicated things like mental health issues and stuff, and you realise that these are actually, you know, project workers and support workers and social workers, and each one of them is from a different organisation. So there might be a Barnardo's person there might be a St Mungo's person there might be a Save the Children person there. That's not really a very good example. There would be probably lots of different people from lots of different organisations who would be trying to give support to these young people. They've all been commissioned by the local council. They've all been told that their responsibility is to reach out to a certain number of children every year. And as Jeff rightly pointed out, they've got to tick some boxes in terms of the number of children they see and how regularly they see them, all those sorts of things. Every single one of those organisations is totally unjoined up. Each one of them holds a different piece of information about the child, right? So Jack, who's sitting on the park bench, might give part of the story to Barnardo's because he knows that Barnardo's will give him a certain amount of money to go off and buy food that evening. He might go and talk to Mungo's about somewhere to sleep. He'll give a slightly different version of the truth. And he doesn't think for a moment that that is a problem, because he just assumes that all these people talk to each other. And this is something that we've now found out quite a lot from working over the last year with young people who are especially leaving care. They assume that to a certain extent all of us talk to each other all the time about what's happening. And when you tell them that we don't have a system behind the scenes that magically makes this work, sometimes they get quite surprised. So wouldn't it be great if instead of standing in front of Jack and taking that history every time, we could ask Jack to opt us in at his preference to some or all of the data that we hold about him. And then, if at a time in the future Jack decided to opt us out, he'd still have control to do that. We wouldn't have to see all of it all at the same time. A lot of this technology exists. It's not hard, right? There's an organisation, you should all look it up, called Yoti. They do online identity access management, Jeff, for young people. And it's all very flexible, in and out and open and closed all the time. And this has been done a lot of times before. And the challenge is, of course, is you're going around the cemetery that you see things on the ground, and they are little things, reminders that people are doing things that are bad for themselves, and they don't necessarily know how to stop or where to get the right help. It's not just about taking information from people, it's also about giving information back to people. So if Jack could have some advice from any of us that went, from a kind of shared confident knowledge bank of the support that we could give or others of us could give around taking drugs or stopping taking drugs, and we could record that we'd had that conversation, and that we could share that with other people who are also supporting Jack at the same time, wouldn't that be great? So that's the vision of the future. I've taken more than 2 minutes, that was bad. So how are we going to do it? There are 3 killers to this, and then there's one really important thing. So the politics is the first thing that gets in the way, right? There's one law, well done Scotland, you win. There's one law about sharing data on children in Scotland. It's really cool. It was written last year, it's almost in plain English. And it says great things in it, boring slides, like a child over the age of 12 is perfectly capable of being in control of their own data. That's really important, because that means that all those people who we don't think we can work with or take legal responsibility from for sharing information with us have that responsibility, have that opportunity. It doesn't mean that we have to stick to some outdated models of adulthood that we might have done in previous generations. There's one law, in theory, about sharing data on children in England, and this is where you might win. So this is beautiful, it's published July, advice for practitioners providing safeguarding services to children, young people, parents and carers, and it's got great stuff in it. It goes further than the Scottish law in England. It says that third-party organisations, those of us who actually provide point of service care, as opposed to the people who commission us, like the NHS or local authorities, have the opportunity to share that data with each other as well, and that's really big. But I lied. There's not one law in England, there are 8, and they all confusingly completely compete with each other. So I'm going to chalk this one up as a win to the bureaucrats, because in Scotland you're winning, right? You've got one law on this. There's clearly opportunity to make the people that write laws go in the right direction on this, but we're not quite there yet. So if you're a person who is really, really good at lobbying people in government to clear up laws and make them really clear about what they mean, then I urge you to use your power. So that's the first bit. Here's a picture of a kitten, because this was really boring so far. So, interpretative dance. This is where it starts to get fun. Who here has a role which involves some element of safeguarding? About a third of the room. Who here, from that third of the room, put your hands up so people can see you. This is important. Who here could give confidently a definition of what safeguarding is? Oh, okay, challenge, right? So we've got these beautiful laws that are all about safeguarding children, but there's this big weasel word in the middle, and it's the word safeguarding itself. And I'm reverting to English law because it's the one I know best, but Whitehall have produced a really nice, clear, straightforward 4-point thing that says this is what safeguarding is, which is great, right? It means that organisations like a hospital or an NHS trust can pick that safeguarding law up and go, great, we know what safeguarding is, that's wonderful. And they nearly get it right. This is the bit where I have to put this down and point at the screen. They nearly get it right. I think this is really important, right? Sharing information as part of safeguarding is really important. And then, hang on a second, everyone that we work with has a different interpretation of safeguarding. It says, if you can't read it, it's quite small. Local arrangements vary for receiving referrals across local authorities, and each will have their own threshold document. So all that great legislation goes out the window, and it's worse if you are, for instance, the London Safeguarding Children Board, who are really good at safeguarding, then your first advice to the members of your board and the people that work with you is not about how you're going to share information at all in order to safeguard children. It's how you're going to respect their confidentiality. You're saying things like, if it is confidential, is there public interest sufficient to justify sharing it? Give me a clear public interest argument about sharing information between 2 charities or public service organisations that are looking after a child. That's going to be challenging. So it nearly works. The Guardian hasn't helped, and various other news organisations don't help with this. GDPR, nothing to do with this at all. But it's a really good debate to be having, right? So let's all have it in public and confuse the issue further. So I'm going to chalk this one up, before I chalk it up to a failure of a government, bad luck government. This is one of our care leavers who's been taking part in our work on providing some new support for care leavers to leave care more resiliently. It's an app which we're going to be launching as part of the brave new world of NHS apps over the next year. And it's basically a thing that basically helps care leavers when they get to the point of leaving children and adolescent mental health services and flip over into adult mental health services, which we all know is a bit of a cliff edge. It helps them to leave much more confidently, self-supportedly and resiliently. And this care leaver in Wales said something that we happen to hear all the time, which is, I'd love to tell people what's actually going on, but I don't trust them with my information. I don't know what's going to happen with it when I tell them, so I lie. And that happens all the time. So we've got this wonderful idea that we have laws in place to support children and help data be shared, but safeguarding gets in the way. So I'm going to, I think if it's okay with you, pass that one as an own goal to the bureaucrats. So the third bit, as a picture of a cup puppy. The third bit is the IT stuff. IT stuff we've talked about a lot this morning, so I won't go into it very much. Does anyone remember this? A few people. Okay, so if you put the word contact point on a screen in front of any health or social care people in England, the whole room just dissolves into groaning. Contact point was, Jeff, the last time that government tried to build a big platform for health and social care data. Back in 2008, we spent £470 million on it as a government, and I was partially involved in it, so whoops. And it was a really big platform. We'll put all our data in one place. And I think the challenge is, and I say this as a former DH person, the challenge is this time round not to build a big platform, but to use the power of what this digital thing really is, which is we've all got the data, we're all really keen to share it with each other. There aren't that many of the big IT companies in the way. Let's build it for them. Let's build the connections between things so that whether it's information in Rio, in the NHS systems, if it's in OLM or System C or Liquid Logic or any, there are only about 6 or 7 of these systems behind the scenes providing social care data capture across the whole of the health and social care network. We could build clever little bits of software to get each one of these to talk to each other, and then we wouldn't have to build a big central repository at all. Somebody from Barnardo's could put data into the Rio system, and if that child on that bench had said, yeah, no, totally, it's fine if you share that data with each other, I'm totally up with that, then we'd all be able to see that same information together. And then we could choose any one of these as kind of the master record, or we could choose none of them. Let's not get geeky about it, it doesn't really matter. It's not hard to do. But digital is not about building big, complicated IT anymore, as Jeff rightly said. Digital is about gluing things together in a way that makes it easier for people. And I'm not advocating for a moment that we live with the complicated IT setup that we have at the moment, and I think it's really important that we move away from that. But if we can use it for good, which is outcomes-focused data for children, all shared together with the child at the centre, that's a really good thing. It's happening elsewhere. Jeff kind of mentioned this already. MOTs, do you do MOTs in Scotland? Okay, good, just checking. We used to go to a garage and they had a really grubby computer in the corner, which was covered in like motor oil and stuff, and they type all your personal details into a system, and then they print you out a thing, and it was like, here's your MOT certificate. And if you were me and you were a geek, you think, oh God, what's happening to all that information? And the reality was quite a lot of it just sat inside that garage, and anyone that wanted could go into the garage and get all of your personal information and also where your car was last serviced. Great. Now it's all behind the scenes, it's in the cloud, all the magic has happened behind the scenes. All of that is all joined up together, and I can go in and check any car that I'm going to buy, is it like roadworthy? And I can do that as a standard citizen. That's a huge amount of work behind the scenes, right, to join all of this up together. But they did it for cars, and cars are way more complicated things than humans, so I think that's quite good. It's happening. It happens all over the place in government, right? There's stickers on government people's laptops all over the country that say things like, make things open, it makes things better. Because it's true, when we share data with each other, we know that we get better outcomes. And even banks are getting in on the act. So HSBC just launched an app where you can put all of your different bank accounts into their app and see all your money in one place. I'm not an HSBC customer, so I don't know whether it works, but it sounds like a good idea, because you don't want to have a different app for every single different thing you have to do, right? So it's all about openness and joining things together. And we've had a play with this already at Barnardo's, right? So this is a prototype, we haven't built it yet, please don't go and copy it because we think it's quite cool and we'd like to be part of helping. But if you want to help us bring it, that would be really cool. So it's an iPad, right? This is the standard piece of kit that costs a lot less than a laptop and doesn't force you to be in an office when you're doing your work. And it's a drag and drop system, so you've got a little kind of prompt. Jack came to table tennis this morning. He felt, and then you drag a little word in, happy or sad or whatever, and it picks up from, the example would be that it picks up enough information on Jack from behind the scenes to make it easy for you to see very quickly as you're adding in your notes, writing up your sessions, what you could do to help Jack. Oh, wait, hang on, Jack does turn out to be quite sad quite a lot of the time. And Jack might be being bullied by his partner. And Jack really likes table tennis and stuff like that. So you can start to craft interventions using the data that we have rather than it going into a big black box behind the scenes. And how much better would it be if, you know, when you click, okay, I've added all the information into Jack's record and it gives you some prompts for what to do next. How much better would it be if you could, behind the scenes, it didn't need to tell you all the information that other people have put in about Jack, but it could tell you some of the other things that are happening in Jack's life. And it could say, there are 3 other people that are also meeting Jack at the moment. Why don't you talk to them? You know, MASH is a great idea, multi-agency help. What's the end of that acronym? MASH, multi-agency support. It's a brilliant thing down in England. Have a look at it if you don't know about it. The idea is that large groups of support networks come together in one place, MASH. It's a great idea. It doesn't happen very often in practice because we're too scared about sharing this information, but it would be really easy to do it, and it's not technically complicated. So, geeks win 2-1. And then the final bit is the only important bit, because the other 3 are really just politics, right? We can get all of that stuff out of the way. And this is a challenge, right? So in the UK, we've had 2 goes so far at sharing data with each other at a big national level. One was identity cards, and the other was care.data. People heard of both of those? Identity cards, thing you put in your wallet, people were really scared. They're going to use it as like surveillance, bad. Care.data, you can share all your data around the NHS and social care as an adult. Oh, and by the way, we're going to share it with insurance companies. Bad. So we get it wrong, but we don't have to. And actually, a lot of this just comes down to public opinion on things. So at the moment, we're really, really scared about big industry organisations misusing our data. Right? You put your information online and it gets ruined. Everything that's known about you is out there as bad. So this only works if it's a trust-based system where the person whose data you're sharing is at the centre of it. It doesn't work if the NHS or any other part of one part of the system holds the data. Right? It has to be person-centric, and it has to be designed around the users. So we're very, very good at adults as thinking, oh yeah, cool, you want to design something for children. Cool, it's going to be in Comic Sans, and it's going to have lots of colours, and it's going to be really cool. No, it doesn't work, by the way. Go and talk to children before you design new digital things. Nobody's written the book yet on what the design patterns for children are. Gov.uk wrote a really good set of design patterns for how we can interact with adults, but that doesn't work for children at all. So we're building that book, we're writing it at the moment. If you want to come and help us, we'd be really, really, really keen on integrating your insight and the research that you've done so far as well. And this is what some of it looks like. So we've started printing out cards that are very gov.uk-y and giving them to children in focus groups and user research sessions and saying, what doesn't work for you about this? And a lot of the time they're like, why are all these extra words here? What's a brief description? Why do I have to like submit something? Even very simple things put people off. So we'd love your help on making sure that happens well. So I think it's a bit of a dead heat, right? We've got this great opportunity with the platform, with the strategy, both up in here and down here in Scotland and down in England, to get much closer to a child-centric view of shared data around a child's social care record or healthcare record. I think we're in a really good place, but it's going to take a lot of our help to get there. So I think that's the challenge ahead of us. And just in case you forgot, this was all about that one child sitting on the bench in Abbey Park who's being approached by all those different social care workers with many different versions of the truth about them. And I had to put that in because Saeed said, remind people why it's important at the end, so I've done it. Thank you.